Yeah.
Okay. On March 23rd, 2010, the Patient Protection and Affordable Health Care Act, which is also known as Obamacare, was signed into law, which over time granted 20 million Americans health insurance coverage. One of the Americans who benefited from this is a 64-year-old woman of color named Jean Jackson. She worked the night shift as a cooling inspector, but because of her cataracts and not having health insurance, she was eventually fired because she could no longer see when she drove at night. Jackson stated, "It was stressful, yes, it was. It was very frightening not being able to see." By the time she became insured because of the expansion of Medicaid in 2019, her cataracts had grown to the point she needed surgery. But this expansion allowed her to get the surgery within months, and she is now able to see when she drives at night and get back to living her life the way she always hoped. Jean Jackson, being an elderly woman of color that was not able to afford health insurance prior to the ACA, helps further show that the Affordable Care Act is beneficial for the United States healthcare system. And this is just further proves one of their main accomplishments, which is providing for more diverse communities. The Patient Protection and Affordable Care Act is beneficial for the United States healthcare system because it helped make healthcare more affordable, it stopped current health disparities from getting worse, and it shifted the importance of our healthcare system from treatment to prevention. So, the ACA is beneficial for the United States healthcare system because it helped make healthcare more affordable, increasing the number of insured Americans. According to the AMA Journal of Ethics, in 2014, families with incomes at 133 to 144% of the federal poverty level will be able to purchase a health insurance plan with benefits specified by the federal government at a cost no more than 3 to 4% of their income, or slightly under $2,000. Similar subsidies will be available on a sliding scale for families with incomes up to 400% of the poverty level. This allowed individuals and families with low income salaries to become insured as the government provided them the funds they needed. Business Insider says a tax credit is a dollar for dollar reduction of your tax bill, and the ACA was expanding eligibility requirements as well as providing tax credits for people to purchase private insurance. Since the ACA was able to make healthcare more affordable, this led to the reduction of racial and ethnic disparities in the prices of health plans. The ACA is beneficial for the United States healthcare system because it stopped current health disparities from worsening. Common health disparities include race, ethnicity, gender, sexual identity, any disabilities, among many others. Minorities are known to have higher rates of disease or illness, fewer treatment options, and less access to care. Hispanic, Black, and Asian patients had the highest uninsured rates before this law, the Kaiser Family Foundation found. According to the American Public Health Association, repealing the ACA would hurt everyone, though racial and ethnic minorities would be particularly harmed. For example, the Urban Institute estimates the uninsured rate among African Americans would increase from 11% to 20% in 2019 if the ACA is repealed and not replaced. The uninsured rate for American Indian Alaska Natives would increase from 14% to 26%. The ACA also says that anyone with pre-existing health conditions such as cancer, diabetes, pregnancy, etc., cannot be discriminated against. The main goal of the ACA is to be able to help people who need it the most, and by focusing on these individuals, also led the ACA to make healthcare more patient-centered. The Patient Protection and Affordable Care Act is beneficial for the United States healthcare system because it shifted the importance of our healthcare system from treatment to prevention. It is important to treat the problem itself, but it is just, if not more important, to find out how to live healthier lifestyles and do regular checkups so that we can prevent these conditions from happening in the future. Preventative treatment helped people from all backgrounds and ages, and an example of this would be how it helped children from birth to age 21. And according to Centers for Medicare and Medicaid Services, health plans will cover preventative care for children recommended under the Bright Futures guidelines, developed by the Health Resources and Services Administration with the American Academy of Pediatrics. These guidelines provide pediatricians and other healthcare professionals with recommendations on the services they should provide to children from birth to age 21 to keep them healthy and improve their chances of becoming healthy adults. The types of services that will be covered include regular pediatrician visits, vision and hearing screening, developmental assessments, immunizations, and screening and counseling to address obesity and help children maintain a healthy weight. Not only did it provide for people who were already ill, but offered care to millions to prevent them from becoming ill. Preventative services are offered to all adults and children, and this further shows how the ACA cares about people of all ages and backgrounds. So the ACA remains beneficial to the United States healthcare system for these very reasons. The ACA's main goal was to increase the number of insured Americans by making it more affordable and easily accessible, which is exactly what it accomplished. It stopped health disparities from worsening, and it shifted the importance of our healthcare system from treatment to prevention. June Jackson is just one out of millions of Americans that have benefited from the ACA. The people no longer have to live in fear of not being able to afford health insurance, of being discriminated against because of racial, ethnic, and health disparities, and of letting their illnesses define how they are going to live the rest of their lives.
Todd Gervich has been using Copaxone to treat his multiple sclerosis for the past 20 years, but it wasn't until Medicare that he had to rethink his usage. Medicare works alongside the Affordable Care Act to help the working poor with an income up to 133% of the poverty level. Annually, Todd's doses will cost him $75,000. In January alone, Todd paid $1,800 and another $900 in February. By March, Todd paid $5,100 to reach his threshold that put him in the catastrophic coverage phase. With that, he now pays $295 a month. It's said he'll owe another $3,000 approximately by the end of this year. He says he feels like he's being punished financially for having a chronic disease, and he is considering discontinuing Copaxone to save money. The drug bill is also another reason why he hasn't retired. Things like this, including Medicare and the prescription drug costs for Copaxone for Todd, is one of the reasons why it's so expensive for people to be insured under this plan. Todd is only one of the few patients who have experienced things like this. It's one example of how the Affordable Care Act is not beneficial for the United States healthcare system. It was designed with three different objectives in mind. One, to reform the private insurance market. Two, to expand Medicaid to the working poor with income up to 133% of the poverty level. Three, to change the way that medical decisions are made, but yet it still fails to meet these specific objectives. As I will continue to discuss, patients like Todd exemplify the negative repercussions that ultimately disassociate the ACA from the original objectives of a healthcare law. A healthcare law is designed to make it more easily accessible for anyone to access benefits. Therefore, I will continue to discuss how the ACA fails to benefit certain demographics from accessing prescription drugs, disproportionately increasing income taxes, and decreasing overall access to healthcare benefits. To begin, I will focus on the prescription drugs and how they are increased through quote unquote donut holes. A donut hole is a gap between beneficiaries and their prescription drug prices that may be caused by purchasing expensive drugs and eventually therefore becoming accountable for the full cost of their medications. For Todd, this was what had happened. The donut hole had exemplified that there is no annual cap or on drug spending. So beneficiaries ideally can pay up to 25% of the price for their brand name drugs until they reach about over $5,000 in out-of-pocket costs. Once patients reach this threshold, it becomes a catastrophic portion of their coverage kicks in and their obligations drops to 5%, but it never disappears. For Todd, that was when he hit the catastrophic phase in his insurance. There's other drugs other than Todd's that have increased in prices as well. For other drugs that's like insulin, its cost has more than tripled. And then there's also a gene therapy for spinal muscular atrophy, which is one of the most expensive drugs in the world that reaches almost $2.1 million. Another medicine, novel care therapies routinely run into the six figures. So we can ask ourselves what's happening at this point. When the ACA was negotiated originally, there was a range of policies that were discussed to help prevent prescription drugs from being so expensive, but they haven't passed. So the Department of Health and Human Services can't negotiate drug prices on behalf of the public buyers, which therefore means they also can't do reimbursements or incentive programs for patients. A former White House advisor, Zeke Emanuel, believes that drug costs can only be blamed on the ACA to the extent that nothing has been put in place to address this issue. This now becomes the fastest growing category of medical costs. Pharma even has found that $84,000 is charged for a hepatitis C cure and $14,000 for a new cholesterol treatment. In response, it's initiated a campaign against Medicare proposal to experiment with new ways of paying for some high cost drugs, including cancer fusions that may cost up to $20 billion a year. Pharma has also raised $32 billion to help close the Medicare gap, the donut hole. In conclusion, this increase in price and prescription drug prices is deeply rooted in the ACA's foundation, which makes it very hard for patients like Todd to continue their treatments at current costs. Another point to be made is the ACA increases income taxes. Taxes increase on the rich in order to help pay for the poor. The Congressional Budget Office has redirected more than $16 billion to the poorest income bracket in the country. This isn't the only money that is being redistributed amongst the richest and the poor. Federal government has spent billions on lower income as well. In 2014, the federal government spent close to $38 billion on Medicaid expansion, and more than half of that went to the bottom of 40% of income earners. Another $15 billion was spent on Obamacare's individual markets. In conclusion, these funds spent on Medicaid expansion, individual markets, and expensive patients positively affected the poorest class while ultimately demonstrating the unequal distribution of healthcare benefits. The overall objective of the ACA was designed to benefit those who needed healthcare, not just the poor. Lastly, healthcare still is out of reach for many of the middle class. For some Obamacare patients or insurers, they do not offer what is ideally promised, affordable healthcare. The middle class is getting squeezed, says Larry Levitt, a senior vice president at the Kaiser Family Foundation. They aren't getting subsidized and their deductibles are hard to afford. In 2015, 46% of uninsured adults said they tried to get coverage but did not because it was too expensive. A last example that I will mention is Irene Selesky. She's a mother of 2 kids looking to purchase Obamacare. She said that medical insurance was meant to keep medical expenses from driving you in a financial ruin, not for the medical insurance to drive you in a financial ruin. She was originally attracted to Obamacare because it was allowed insurers with pre-existing conditions. However, she then saw the prices and failed to further the process of Obamacare. She's ideally considering dropping this plan and considering the penalty because of the expense. Irene said it herself. This wasn't the United States healthcare system, or it's not what the healthcare system was designed to do, and nonetheless, the ACA. Together, this increase in prescription drug prices and income taxes, as well as an overall access to Obamacare, has made it hard for many Americans to support the Affordable Care Act. In conclusion, this is one of the most neglected parts or in conclusion, the ACA remains as a continuous failure to the United States Healthcare Act for those very reasons. Starting with prescription drug prices, we see how certain drugs have become increased in prices dramatically, preventing patients from purchasing them and potentially using them. The rise in income taxes has disproportionately affected the richest class while positively affecting the poor. As a whole, the ACA has widened the gap between the rich and poor, making it even more difficult for the middle class to afford Obamacare. Looking at these 3 arguments alone, it's easy to grasp why patients similar to Todd are struggling to support a failing healthcare system.
Many have argued that prescription drug prices have increased because of the ACA, but it is said that Obamacare is not responsible for the entire area of prescription drugs. And this is a problem that lies with the insurers themselves because drug companies are still able to set their own prices. While some people have also argued that income taxes have increased because of the ACA, and although taxes were raised for all people, the group that faces the real burden of this are the rich people in the 1% category, and the point of this is to result in giving more to the poor. Lastly, another argument that many have made is that the ACA is too expensive for most people, but it still does provide for people who had not been able to afford insurance before. And New York Times states that 2/3 of customers on healthcare.gov can find a plan for $10 a month, and in some cases, the tax credits can lower the monthly premium to 0. People can also be entitled for compensation for many different reasons when they seek care.
Recognizing Francesca's argument for the United States healthcare, okay, that. No. Recognizing Francesca's argument for the Affordable Care Act, I believe that it still fails to benefit the United States healthcare system. She says that it made healthcare more affordable. However, I feel that there's still many that aren't able to access it due to the cost. One including um, Irene Selesky, the mother of two kids that I mentioned, she talks about how the Obamacare policy cost twice as much as her mortgage, and therefore she is not able to afford it. She was originally attracted to Obamacare because it allowed insurers with pre-existing conditions, but then she saw the prices. To reinstate this idea, there's also a statistic that demonstrates 46% of uninsured adults said that they tried to get coverage but did not because it was too expensive. Francesca's second point talked about how she shifted the emphasis for treatment to prevention. I still believe that this is a main focus that should ideally be like focused on no matter the healthcare system. Doctors naturally do embed this culture of taking care of patients from day one, and it shouldn't be something that changes from healthcare system to the next. And the third reason she talked about was that the ACA stopped current healthcare disparities from worsening between different races, income, pre-existing condition insurers. And I feel like there are so many discussions that exemplify this issue still resolves in many healthcare systems. And I know that no healthcare system is going to be perfect, but even Larry Levitt, the senior vice president at the Kaiser Family Foundation, says that the middle class isn't getting subsidized and their deductibles are hard to afford. And so there still remains this hierarchical issue between different classes based on their income and what healthcare that they can afford. So I still believe that the ACA is failing to benefit the healthcare system today because um, the access to prescription drugs continues to rise and the prices as well do. And secondly, there's a disproportional increase in income taxes. And overall, I feel like there's a decrease in access to healthcare benefits through this system.